I'm Alice. Welcome back to Men Health 30, where we don't shy away from the truths about men's health, especially sexual health. Did you know that 10% of men under 40 and up to 50% of men between 40 and 70 will face erectile dysfunction at some point in their lives? That's not a small number, but what's even more concerning is that many of them are still using medication the wrong way, leading to reduced effectiveness or even no results at all. In this video, I'm going to show you 5 science-based tips that urologists actually apply in clinical practice to help maximize the effects of Tadalafil, the medication considered a key solution for treating erectile dysfunction. If you've ever wondered why the same drug works amazingly well for some people but for you it feels like nothing happens, the answer is coming up. Watch until the end of the video, because sometimes just one small change can help you regain the performance you thought you had lost. Tip number 1, and also the most fundamental, make sure you're taking a medication that is truly high quality. This is something many people overlook. They ask, aren't generic drugs the same as brand name ones? It sounds reasonable, but the truth is more complex. While the active ingredient may be the same, the purity, absorption rate, and bioavailability can vary significantly depending on the manufacturer. And when you're taking a drug that needs to work quickly and effectively, quality becomes absolutely critical. In clinical practice, urologists often recommend trusted brands like ZAD or Cialis, not because of advertising, but because they've seen the consistent results firsthand across thousands of patients. These brands offer better stability, reliable performance, and minimal variability in absorption, which directly affects whether you get the results you're aiming for. So don't gamble your performance on a cheap pill with an unknown source. One right choice can make all the difference. Tip number 2, don't let your meal ruin the effectiveness of the medication. You might be using the right type of Tadalafil at the right dosage, yet still not experiencing the results you expected. So what's going wrong? First, you need to know this. Tadalafil is commonly sold in 2 doses, 5 milligrams for daily use and 20 milligrams for on-demand use. If you're using the 20 milligrams dose, this is the stronger version, intended for use before sexual activity, and it can stay active in your body for up to 36 hours, depending on the drug's quality and how well your body absorbs it. But here's where many people make a critical mistake. They take the pill right after a heavy meal or while drinking alcohol. This slows down Tadalafil absorption through the digestive system, which leads to reduced effect, delayed response, or in some cases, no effect at all. So, if the same pill that once worked now feels useless, the timing of your intake may be the real issue. Backhand index pointing right, try taking the medication on an empty stomach, at least 1 hour before eating. Backhand index pointing right, and if you're planning to drink alcohol, avoid taking the pill around the same time. Sometimes just shifting when you take the pill can help you feel the full effect you thought you'd lost. Tip number 3. Tadalafil isn't a magic pill if you don't flip the switch the right way. A very common misunderstanding is this. People think they just need to take the pill, wait around, and their body will automatically respond. But science is clear. Tadalafil doesn't cause erections on its own. It only supports the process when sexual arousal is already present. In other words, if you take the pill and then lie in bed reading, watching TV, or scrolling your phone, don't expect results. The erection process starts in the brain and nervous system, not in the pill itself. Tadalafil only works when arousal signals are triggered through emotions and sensory input. Backhand index pointing right, that could be eye contact, a scent, a light touch, a warm gesture, anything that awakens your inner desire. So remember, take the right dose, but don't forget to activate your brain. Create the right setting, mood, and emotional connection, because only then will the medication actually have a role to play. No arousal means no reaction. No matter how effective the pill is, if you skip this part, the results will always fall short. Tip number 4, don't get the dosage wrong. The right drug at the right time is what brings results. You might be taking the right medication, but if you're using the wrong dose, all your efforts could end up wasted. Currently, the two most common active ingredients used to treat erectile dysfunction are Tadalafil and Sildenafil, Viagra. Both belong to the PDE5 inhibitor group, and they work by increasing blood flow to the penis. However, each drug and each dosage has its specific indication. Backhand index pointing right Tadalafil 20 mg, specifically for on-demand use before sexual activity, not meant for daily use. Backhand index pointing right Tadalafil 5 mg, a lower dose used for daily maintenance treatment, even when no sexual activity is planned. A common mistake: some people think taking 2 5 mg tablets, totaling 10 mg, will give a stronger effect when needed. But in reality, the way these doses are absorbed and how long they act in the body are completely different. Similarly, Sildenafil, Viagra, the well-known blue pill, comes in 25 mg, 50 mg, and 100 mg doses. Each person responds differently, which is why guessing the dose based on feeling often leads to disappointment. Backhand index pointing right best practice: start with the standard dose, typically 20 mg for Tadalafil or 50 mg for Sildenafil, and adjust based on your body's response, under the guidance of a doctor. Choosing the right dose is the first step toward getting full results. The wrong dose, whether too little or too much, can leave you far from your expectations. Tip number 5: timing matters. You'll only feel the full power of the medication if you take it at the right time. Most men have heard, just take Tadalafil about 30 minutes before sex, and you're good to go. It sounds reasonable, but the truth is you could be missing the golden window, where the drug works best. Backhand index pointing right Tadalafil can remain active in your body for up to 36 hours, but don't let that number fool you. Backhand index pointing right the peak effectiveness, meaning maximum blood vessel dilation and optimal blood flow, happens within the first 10 hours after taking the pill. And here's what many urologists often mention, but most people overlook. Instead of taking the pill right before sex, try taking it at least 1 to 2 hours in advance. This gives your body time to absorb the medication fully, distribute it evenly in your bloodstream, and prepare you both physically and mentally for intimacy. Thanks to its long half-life, you don't need to time it down to the exact minute. But if you want to maximize the effect, aim for that golden window, between 2 to 10 hours after taking it. Right drug, right dose, but wrong timing? Still wrong. So take it earlier than you think. Sometimes, moving your schedule by just 1 hour can change the entire experience. After the first 10 hours, Tadalafil's effect gradually starts to wear off, as your body begins clearing the drug from your system. And if you've made it this far and still feel like, I've taken the right pill, the right dose at the right time, but still don't notice much difference, or you simply feel the need for a natural, safer boost without relying solely on medication, then this might be the time to discover a completely different solution. Backhand index pointing right, a simple ritual that takes just 7 seconds a day, done right at home, is now gaining attention from men's health experts around the world. No pills, no interventions, yet it has helped thousands of men restore desire, improve erections, and most importantly, reclaim the confidence they once lost. Directed important: this video might be taken down at any time. Watch it now, while it's still available. And if you found today's content helpful, don't keep it to yourself. Backhand index pointing right, share it with a man you care about. Backhand index pointing right, subscribe to Men Health 30 and turn on notifications, because every week we bring you real, honest, no-nonsense advice for men's sexual health, especially for those in midlife. I'm Alice. Thank you for watching, and I'll see you in the next video.